That tingling in your hands and feet, the pins and needles you keep shaking out, could be the first sign of nerve damage that becomes permanent if you wait too long. And one of the most common causes behind it is a single vitamin that a lot of people over 40 stop absorbing properly, no matter how well they eat. I am Dr. Hale. In my 15 years in internal medicine, tingling hands and feet is one of the symptoms people apologize for bringing up. They wave it away at the end of the visit. Oh, and my feet buzz a little at night. But it is probably nothing. Here is what I want you to hear today. It is usually not nothing. It is your nervous system flagging you down, and whether it turns out to be small and fixable, or something that needs real attention, the difference between catching it early and catching it late can be the difference between full recovery and damage you keep for good. So today I am going to explain why your hands and feet tingle, walk you through the main causes, and give you the one honest rule that keeps people from making this worse. And I will be straight with you now. There is a very common mistake people make the moment they hear the word vitamin, and it can bury the real problem for years. I will get to that, so stay with me, because the thing most people reach for first is often the thing they should do last. Let me show you what is actually happening inside you, because once you picture it, the whole topic makes sense. Think of your nerves as the electrical wiring of your body. Millions of tiny wires run from your brain and spinal cord out to every fingertip and every toe, carrying signals in both directions. And like any good wire, each nerve is wrapped in insulation. In your body, that insulation is called myelin, a fatty coating that keeps the signal clean and fast. When that insulation frays, the signal leaks and misfires. Your brain reads those misfires as tingling, buzzing, burning, or numbness. So tingling is not your nerve going quiet. It is your nerve sputtering, like a wire with the coating worn through, sparking where it should not. And here is why it shows up in your hands and feet first, not your chest or your back. The nerves that reach your feet are the longest in your whole body. They run all the way from your lower spine down to your toes. A longer wire has more surface to go wrong and sits farthest from its power source, so when something is stressing your nerves across the board, the longest ones feel it first. That is why doctors so often hear the same story. It started in my toes, then the bottoms of my feet, then my fingertips. There is one more clue hidden in that pattern, and it is worth knowing because it tells you a lot before you ever see a doctor. When a problem comes from something affecting your whole body, like a low vitamin or high blood sugar, the tingling usually shows up in both feet at once, evenly, in a shape doctors call a stocking and glove pattern, as if you were wearing invisible socks and gloves of numbness. When it shows up in just one hand, or runs down only one leg in a stripe, that points instead toward a single pinched or squeezed nerve. So notice the shape of yours. Both sides evenly is one kind of story. One side only is a different one. Either way, it is worth checking, but that detail helps your doctor aim faster. Now let me take you through the causes, starting with the two big ones. The first is that vitamin I mentioned, B12. Vitamin B12 is one of the main ingredients your body uses to build and maintain myelin, that insulation on your nerves. Run low on B12, and the insulation starts to break down. The National Institutes of Health Office of Dietary Supplements is clear that numbness and tingling in the hands and feet is one of the classic signs of B12 deficiency, and that this deficiency can damage the nervous system even before it ever shows up as anemia on a blood count. That last part matters. People assume a shortage would show in their red blood cells first. It does not always. The nerves can take the hit while the blood count still looks fine. Here is why this hits the 40 and over crowd especially hard. To pull B12 out of your food, your stomach needs to make enough acid and a helper protein called intrinsic factor. Both of those tend to drop as we age. The NIH notes that a meaningful share of older adults develop a condition where the stomach lining thins and stops making enough acid, and those people absorb far less B12 from food, even when their diet is full of it. Add to that two extremely common midlife medicines. Metformin, taken by millions for blood sugar, is known to lower B12 over time, and the acid-reducing pills people take for heartburn, the ones you can stay on for years, cut B12 absorption too, because they shut down the very acid you need to free it from food. So you can eat steak and eggs every week and still slide low. The second big cause is high blood sugar. This is the other heavyweight, and it works differently. When blood sugar runs high year after year, from diabetes or even from the earlier prediabetes stage, it slowly damages those small nerves directly, especially the long ones in the feet. The National Institute of Diabetes and Digestive and Kidney Diseases reports that a large share of people with diabetes, well over half, develop some form of nerve damage, and for many of them, tingling or numbness in the feet is the very first clue they get. The National Institute of Neurological Disorders and Stroke describes the same pattern. High sugar behaves like a slow acid on the wiring, and it starts at the far ends. This is why a doctor who hears tingling feet will almost always check your blood sugar, because catching it while it is still prediabetes gives you the chance to stop the damage before it settles in. Now let me tell you about someone. I will call her Nora. She is a composite of many people I have seen, not a single real patient. 59 years old, sharp, active, on an acid reducer for reflux that she had been taking faithfully for 6 years. She came in about her feet, a buzzing at night, then a numbness creeping up from the toes, then a couple of times losing her balance in the dark hallway to the bathroom. She had told herself it was her shoes, then her age. Then just one of those things. Her exam and a simple blood test told a different story. Her B12 was very low, drained slowly over years by the very medicine helping her stomach. We corrected it, worked with her doctor to rethink the reflux plan, and over the following months, much of the tingling eased. But here is the honest part of Nora's story. She had waited almost 2 years. Some of the numbness in her toes never fully came back. Catch it at year 1, and she likely recovers all of it. That gap is the whole reason I am making this video. Now, the mistake I promised you at the start. The moment people hear that B12 can cause tingling, a lot of them do the same thing. They walk into a store, buy a big bottle of B12, and start taking it on their own. I understand the instinct. But this is the thing you should do last, not first, and here is why. Tingling has many causes, and B12 is only one of them. If you self-dose B12 and your real problem is creeping blood sugar, you have just spent months treating the wrong thing while the actual damage continues. Worse, high-dose B12 can partly mask a deficiency on a blood test, making it harder for your doctor to see clearly what is going on. So please do not turn this into a guessing game with a supplement bottle. Get the cause identified first. Then treat the right thing. If this kind of plain, honest health information is useful to you, take 1 second and subscribe to Dr. Hale. And tell me your age in the comments. I read them, and knowing the ages of the people watching genuinely shapes what I cover next. All right, let me give you the other causes worth knowing, because tingling is not always about a vitamin or blood sugar at all. The third cause is a pinched or compressed nerve. Sometimes the wire is fine everywhere except one squeezed spot. Carpal tunnel syndrome pinches a nerve at the wrist and sends tingling into the thumb and first fingers, often worst at night when you wake up shaking your hand out. A worn disc in the neck or lower back can press a nerve root and shoot tingling down one arm or one leg. The tell here is that it is usually on one side or follows one specific path, rather than showing up evenly in both feet. The fourth is poor circulation. If the arteries feeding your legs are narrowed, The nerves downstream do not get enough oxygen, and you can feel numbness, coldness, and tingling. A clue for this one is cramping in your calves when you walk that eases when you stop and rest. And there are a few more that a good doctor keeps in mind. An underactive thyroid can cause tingling along with fatigue and feeling cold, and it is a simple blood test to check. Heavy, regular alcohol use is directly toxic to nerves over time, and it drains the B vitamins those nerves depend on, a double hit. And here is one that catches people off guard: too much vitamin B6. B6 is good for your nerves in the right amount, but taking very high doses of B6 supplements for a long stretch can actually cause the tingling you were trying to prevent. It is one more reason that loading up on random vitamins on your own can backfire. I want to be honest about something, because it is the whole point of this channel. These causes are not always separate. It is common for 2 or 3 of them to be working at once. Someone with early high blood sugar, who also drinks a few nights a week, and who takes an acid reducer, is getting a triple hit to the same wiring. That is exactly why guessing fails and testing works. A doctor can sort out which factors are actually in play for you, and often it is several small corrections together that turn things around. So here is what to do this week. 1. If your hands or feet have been tingling regularly for more than a couple of weeks, make an appointment. Do not wait for it to get louder. This is a see your doctor situation, not an emergency, but not a someday either. 2. Ask specifically for blood tests to check your B12, your blood sugar, and your thyroid. Those 3 simple tests cover a huge slice of the common causes. 3. Bring a full list of your medicines and supplements to that visit. If you take metformin or a long-term acid reducer, say so out loud, because those point straight at B12. 4. Do not start high-dose B12 or any B vitamin on your own before that visit. Let the testing happen first, so your doctor sees a clear picture. 5. If you already know your blood sugar runs high, treat that as the front line. Bringing sugar down is one of the most powerful things you can do to protect these nerves. Now the clear line, because this matters. Everything here is education, not a diagnosis, and it is not a substitute for your own doctor. I do not know your history or your medicines. Most tingling is not an emergency, but some things are. If numbness comes on suddenly on one side of your body, or with weakness, drooping in the face, trouble speaking, or trouble walking, that can be a stroke, and that is a call for emergency help right now, not a wait until Monday. And if you have diabetes and any numbness in your feet, protect them like they are precious, because numb feet do not feel a blister or a cut, and a small injury there can turn serious fast. Check them every day, and treat any slow-healing sore as a reason to call. Here is the hopeful part, and it is real. Unlike some kinds of nerve damage, tingling caught early from a low vitamin, a thyroid problem, or blood sugar that has just started to climb can very often ease or fully resolve once the true cause is fixed. Nerves heal slowly, but they heal when you take away the thing that was hurting them. That is the entire reason to act while the window is open, instead of shrugging and deciding this is just how your feet are now. Nora got most of hers back earlier, and she would have gotten all of it. I want to set your expectations honestly, though, because nerves do not bounce back overnight. These are the slowest healing tissue in your body. When you fix a real B12 shortage, the sharp tingling and buzzing often settles first, sometimes within weeks. But full sensation coming back can take many months because the nerve has to slowly rebuild that frayed insulation inch by inch. So do not judge your progress after 2 weeks and give up. Give it a season. Keep working with your doctor on the underlying cause, and measure the trend over months, not days. And there is a line past which some damage does not fully return, which is the entire argument for catching this early rather than waiting for it to get loud. The window does not stay open forever. It just stays open long enough that most people who act have time. The ones who suffer are almost always the ones who waited. Let me leave you with this thread. Today we followed the wiring out to your hands and feet, but there is another organ running on its own electrical system every second of your life, and when it starts to strain, it sends signals too, ones people mistake for being out of shape or just getting older. In my next video, I am going to walk you through 5 signs that your heart is working too hard, so you can spot the strain before it becomes something bigger. Subscribe so it reaches you. Whether you are 45 or 75, your nerves can often recover when you catch the cause in time. The window is open right now. I am Dr. Hale. Take care of yourself.